So I'll begin the session, and we have a couple of panelists that will be joining us in a bit as well. So thank you very much for joining us again. This is a continuation of the previous session that was taking place prior to lunch. National progress on the SDGs and challenges in the context of COVID-19, reflections on VNRs in South and Southwest Asia. So we have a very august panel with us yet again for this session. Firstly, we have our Honorable Chair, Ms. Mehnaz Akbar Aziz, who's Parliamentary Secretary for Law and Justice, Government of Pakistan. We have representatives from SSWA countries, Dr. Ali Ghulampour, who's Head Department of Development Issues, Ministry of Foreign Affairs, Tehran, Islamic Republic of Iran. We have Ms. Fatima Shazli, who's Senior Planning Analyst, Ministry of National Planning, Housing and Infrastructure, Maldives. We have Mr. Keval Prasad Bhandari, who's Secretary, National Planning Commission, Nepal. We have Mr. Veysel Sarchi, who is Expert Strategy and Budget Office of Presidency of Turkey. We have Mr. Razik Shinwari, who's Economic Policy Advisor, Federal SDGs Support Unit, Ministry of Planning, Development and Special Initiatives. We have a CSO representative with us as well, Mr. Ziaur Rahman, Chief Executive, Awaz Foundation, Pakistan, Center for Development Services, Pakistan, who will be joining us shortly. So thank you all for joining us. Thank you to all the panelists for taking out time for this session. Without further ado, I'd like to invite our first speaker for today, which is Dr. Ali Ghulampour. Sir, in the interest of time, I'd request you to restrict your intervention to 10 minutes. Over to you, sir.
Yeah, good afternoon, everybody, and I hope that you have had your lunch and come back to the meeting, this plenary session, with enough energy and appetite for having a discussion and exchange of views on a topic which is very, very important for all the countries in the world, especially for our region and sub-region. However, I would like to touch upon the issue of VNR from the viewpoint of my country, which is under special conditions or a special situation, which is now defining and limiting the ability and capabilities of my country and the people and the government for doing their job in moving forward towards implementation of the SDGs. In 2015, when the General Assembly conference was being held to adopt the agenda for 2030 of the UN, and in there, and even over the course of the different negotiation rounds on the elements of SDG and the document itself, many countries, including and especially my country, raised its concern regarding some part of the document, which may be in the future, in the course of implementation, to be conflictual or in contrary to the national priorities or national policies, including the religion, rules and regulation, and the Sharia. And in that context, my country, the delegation of the Islamic Republic of Iran has presented and delivered its reservation on the Agenda 2030, and by that reservation emphasized and made clear that Iran will not be obligated to fulfill those parts or elements or sections of the SDGs which are in contrary with the national priorities and national policies and laws and regulations. With that, so we came in 2016, 17, and 18 into the phase of implementation of VNR in Iran, and the first draft and the first version of the VNR for my country was prepared in 2018. However, despite the fact that all the preparations was made in that time, the VNR was not delivered in HLPF due to some sensitivities in Iran regarding, as I told you, regarding those parts which covers and are related to the reservations which has been made by my country. However, the new government in Iran is now planning for preparation for an updated version of the VNR. We hopefully, it is my assumption that it would be delivered most probably in 2024 in HLPF. Sure. I will get back to your point under the COVID, but for that purpose, I have to explain about the conditions that we are now living in under the UCMs, unilateral coercive measures, and the sanction regimes. You know that sanction regimes and UCMs against my country are really unprecedented historically. It has cut all the flows from Iran and into Iran. Flows of funds and finance, all finance and financial transactions are cut. Trade has been heavily impacted. Even for humanitarian and health medicines and healthcare medication and equipments, we have not been able to import those medicines and equipments that are needed for the hospitals and for the curement and treatment of the many different diseases. However, fortunately, that sort of imposed sanction regimes and UCMs has helped my country and my people to stand on its own feet and on its resources and domestic abilities and capabilities. So there has been a lot of energy spent to mobilize and besiege all the resources heavily and very sincerely depending on the national and domestic resources. Therefore, and because of that determination by the country and the people as well as the government, my country, Iran, has been able to produce and make, let's say, infrastructure and also to production for the COVID-19 vaccination. So in Iran nowadays, we have our national vaccines. 4 or 5 types of vaccines has been produced nationally using all the assets, scientific assets and knowledge of national and local knowledge. And however, it was due to the sanctions, which we are not able to pay for those vaccines that in the first days of the pandemic, we couldn't able to pay for import of the medicines and vaccines. Unfortunately, in Iran, we were witnessing a huge number of loss of lives and peoples around, or more than 135,000 people. Unfortunately, they lost their lives. So that was really a misfortune situation for Iran. But anyway, eventually we were able to import from a very difficult and long process of bureaucratic process through UN agencies to import initially vaccines, and then we made and produced ourselves. And nowadays we are really very rich in that perspective.
Dr. Ali, I'm going to interject here. And so you mentioned in your earlier conversation that, and for good reason, I respect Iran for doing that, that, you were not pleased with the way VNR was and you wanted to have your national interest in the forefront. And you reviewed the VNR.
Sure.
So would you be able to, would you kindly tell us how you were able to review it? And what was like, what didn't work for you and what worked for you?
What I said was that we prepared our first draft of VNR, but as I told you, because of some domestic and internal sensitivities, my government decided not to deliver it at that stage in 2018. But now with the new government and presidency, we are now working on starting the reviewing and updating that first version of our VNR. So it's just we are in the beginning of the process, and we are very much hopeful that within 1 year or 2 years latest to be able to update and produce the second version of our VNR. And as I told you, all the elements there has been by leveraging and using domestic resources and capabilities in the field of, for example, the housing and resilient and sustainable cities and communities. We have been able to, and also within the frame of the SDG 17, which is partnership, we have been able to work closely with the SCAP, UN SCAP, to establish a center of SCAP, which is focused on the natural disaster reduction, repercussions and casualties. And the center now is being hosted by my country. And up to now, despite the fact that we have had many difficulties in funding the activities of that center, APTIM, Asia Pacific Center for Disaster Information Management. However, and despite the fact that we have been targeted for the sanctions, my government has been able to pay in cash around $6 million to that center, and also to provide with the in-kind buildings, logistics, and management. And the center has been able to be at the service of the needs of the countries in the region in the field of disasters. That's an example that I wanted to highlight on that. But because of the time that I'm not able to go to my homework, unfortunately.
Your situation, each country has a specific situation.
Of course, yeah.
And I would really like that, you have, Iran has stood on its own 2 feet and you've determined your own course of action. And the world has not treated Iran well. But can you conclude by also telling us what have you done for the social sectors, for the well-being of the people and others?
Yeah.
And that fits into although it may not be in the system of the VNR, but actually it is fulfilling the SDG goals. Can you highlight that?
In social aspects of the SDG, my country has been very successful and achieved many indicators for the SDGs in the field of education. Nowadays, the percentage of the women and girls of the universities are more than the male and men. So it's really very impressive, and we are proud of that. The education system is countrywide. All the areas, urban areas, rural areas are covered by the schools, and there is a movement, national movement for building schools and bring all the infrastructures and equipments needed, including especially with access to internet. So nowadays in Iran, everybody has access to internet, and the social aspects are really, really strong, and I think it's a matter of praise. Thank you.
Thank you so much. And I would also like to comment that and congratulate Iran on dealing with a situation that arose from the women's movement, but it was able to negotiate and do it, according to the wishes of its people also. And that's remarkable.
If you allow me just conclude with that, my country has been victim to the political aspirations and agendas in terms of human rights. Human rights is, when we are talking, is having access to food, having access to medicine, having access to the, all means for having a prosperous living standards and conditions. And when you are not able to transact and pay, for example, for hospital equipments or humanitarian aspects of that, which you are very much indeed. And when you are a country that you are hosting more than 5 million refugees, so it's really hard to understand how it means that when we are talking about a victim of a political agenda by some countries. Thank you so much. All the best.
Thank you so much. It was eye-opener. It was an eye-opener.
But if I had time, I could read for you some part of it is very interesting. Sir, and impressive.
If we have
just the title, it's the special rapporteur on negative impact of unilateral coercive measures has produced a report which is very recent. It's 2-3 months ago, and if you go through those pages, you will find that how many progress Iran has had on the SDGs and how challenges and difficulties has made detriment on the work of the government.
I would love to have a copy of that. And if we have time, I think we can, to all those who are interested, we can share on our website, the conference website. This would be very important. Thank you so much. And who will be our other speaker, the next speaker?
Thank you very much, ma'am. Next, Ms. Fatma Shazli. I would request if you can restrict your intervention to 10 minutes in the interest of time.
Because it's an unusual situation.
Assalamu alaikum. First, I would like to highlight that first, I would like to highlight that the 6th South and Southwest Forum is a great opportunity to collaborate with our neighboring countries and share knowledge of in implementing and achieving the Agenda 2030. The partnership countries is crucial for a region to establish the effort to work towards a common goal. We as individual countries, countries are vulnerable in so many aspects. According to the Sustainable Development Report 2022, Maldives was ranked at 67 out of 163 countries in the global SDG ranking, with an index score of 71. Out of 17 goals, Maldives has achieved 1 and 4 and are on target while having major challenges with goal 2, 5, and 14. Much still need to be done in the areas of gender equality, climate action, and environment sustainability, and access to timely data is needed to make effective policy decisions. While moderately improving, 8 goal still remains with significant challenges, and goal 15 is reported a decreasing trend as it was in 2021. COVID-19 has proven not only to be a health pandemic, but a devastation on our economies and livelihood. More efforts. Maldives depends on 90% of food imports, and COVID-19 has affected the food security of the country. More efforts are made to strengthen local food production, supply, and distribution chains in order to reduce food wastage. Amount of waste generated is has increased in home deliveries and takeaway foods during the pandemic. Though the volume of waste generated cannot be measured due to lack of data available. A third of the population of Maldives is identified as being multidimensionally poor. And with COVID-19, the fear of reversing years of progress towards eliminating poverty in country has increased. Service prevention and response teams were put under immense pressure due to the increase in sexual exploitation and abuse, gender-based violence, mental health issues, and non-COVID health issues as a result of the pandemic.
Can you please enlighten our audience with the actual population of Maldives? What is the size of Maldives?
The population of Maldives is I'm sorry, I don't have it written down, but I have it on my table.
Yeah, okay.
So I can have.
Someone Google it?
No, it's there. I have it with me.
Okay. Yeah, it would be good to know the size of your country. Any of these.
Ma'am, I wanted to request if you could speak in the mic so that it comes in the recording as well.
Mine?
Yes.
Okay. So I've asked about the size and the population of Maldives to know, the actual impact of COVID and what was done. And
Right, her colleague is just bringing in the stats.
okay. So we'll carry on.
Okay. In ensuring availability and sustainable management of water sanitation for all, there is a disparity between Mali city and outer islands. Safe drinking water and sanitation process is to be done in outer islands, particularly with some islands in building the water and sewerage system, which is underway. Maldives being a geographically dispersed country, ICT offers solutions to bridge the geographic divide and bring service closer to people. The COVID-19 pandemic has proven capacity and adaptability of service and business entities to accelerate the use of digital technology. Technology has become an essential access to basic service, but with this accessibility, a lot of inequities have been created in acquiring affordable internet. A part of this, COVID-19 has also created a lot of distinction between different occupations, among which are knowledgeable workers and manual workers, people working remotely, and those who are working in frontline. Though these inequalities are to impact differently in different working groups. Maldives has prioritized SDGs and works together with developing partners to conduct the assessment. We collaborated with Maldives Bureau of Statistics to formulate the National Strategy for Development of Statistics. The NSDS, being a 10-year strategy document, will support the government of Maldives in realizing the national and international target and commitments. The National Strategy for Development of Statistics. We have formulated this document with Maldives Bureau of Statistics. The NSDS will focus on strengthening the SDG indicator framework by which we will be able to review the available data and measure the progress and enhance reporting SDGs. Additional efforts are being made to work with stakeholders to formulate mechanisms to collect the missing data identified in the SDG report published in 2018 and 2020. The development plans we have been following has changed with the pandemic as it has affected the socio-economic aspects of Maldives. We must face these challenges with great effort and stand stronger than ever to overcome through innovation, strategic long-term policies, and collaborative decision-making process. Yeah, I'm just. Moreover, I would like to highlight that Maldives has succeeded with the largest commitments by the government, which is to ensure that all Maldivian citizens are connected to the country's economy, infrastructure, and social services through an efficient, reliable, convenient, and sustainable national ferry network. The establishment of integrated national public ferry network throughout the country has been successfully conducted. The project that is targeted to be implemented in 3 phases has successfully completed its first phase and is speedily working on establishing the rest in the next 2 years. The establishment of National Public Ferry Network will also pave way for regional cooperation between South Asian countries in the future with development of the country and facilitate trade route between the countries. Moving forward, we are focusing on diversifying the economy, creating job opportunities, and reintegrating the redundant workforce back into the labor force and support the MSMEs and fiscal stimulus through the National Resilience and Recovery Plan. In addition, we have conducted the census during September of this year, and we are waiting for the preliminary results. This year, for the first time, we had economic census carried out together with the population census. With this, we will have a very robust data set as we move on to our second VNR. We have submitted our first VNR in 2017, and we are to submit our second VR next year. The VNR will be a way of highlighting the progress of SDGs and identify the major challenges for implementing of the Agenda 2030 as of 2022. Maldives is committed to achieve the Agenda 2030. We are working on strengthening our data system and integrating policies to achieve the targets stated in the SDGs. We need support of our stakeholders and development partners to overcome the challenges we are facing. Yeah.
But I would just like to ask you a question. Are there any key challenges that you face? I think key challenges that you face in fulfilling the SDGs or implementing the SDGs agenda.
Yeah, actually, we have quite a few challenges that we have been facing, especially when it comes to providing achieving goal 6. Providing water, because as Maldives is a dispersed country with small islands, for the simplest things like mobilizing the countries with workers to provide the service itself is also a big challenge for us.
Thank you. I think we can invite the next speaker.
Yes, so next is Mr. Keval Prasad. So over to you.
Thank you, Madam Chair. So I have a presentation and I already submitted to the Secretariat. So can I go for presentation, but it takes more time. I have to limit in 5, we can talk. So thank you, Madam Chair. Yes. So please follow the presentation there, no problem. Because SDG, all countries have the same format and same financing gap and same strategy, same obstacles to implementing SDG in our parts of the world. Actually, I just want to make some brief introduction that beyond 169 targets, Nepal prepare 479 targets for the initial stage, but it's very hard to make the data. So this year we reduced 479 indicators to 300. So it's data supports for our upcoming VNR. I just want to overview on SDG situation, achieving SDG in Nepal. So we streamline these things from our previous plan in 2016 initially. In 2015, we have a new constitution which directly focus on rights and facilities and development of the people this republic country. And parliamentary report we prepare on SDG in 2015. In 16, we internalize SDG in 14th plan. In 17, we SDG status report published. SDGs committee were formed and we submitted first VNR in HLPF in UN. In 2018, SDG need assessment, costing and financing strategy was completed, and planning and monitoring guideline for province and local was prepared. In 19, SDG aligned with 15th plan, and the province and local level planning guidelines we prepared, and SDG localization is one of the main agenda for SDG localization is one of the agenda because country become federal and provincial and local government has to implement many of the SDG indicator. In 20 SDG progress report we prepare, and second VNR we submitted to HLPF, and we also prepare resource book for SDG localization. In 21 and 22, in 22 we prepare known leave behind report and SDG localization workshop for all local levels. 753 local government was aware and oriented for the SDG activities, and we participate in 2023 HLPF, and we are in the process of preparing a third VNR in 2023. So our effort on streamlining SDG in national processes, we prepare medium-term expenditure framework incorporating SDGs for all ministries and departments, and National Planning Commission is the focal agency for preparing a medium-term expenditure framework. We also prepare National Evaluation Action Plan for the evaluation of SDG, and we prepare fulfilling the gap of data. We prepare a national data portal, and all local government and provincial government are oriented and trained to fulfill the data gap there. And we have some structural framework under SDG. There are parliamentary committee focused on SDG and SDG goal. And there is a high-level steering committee chaired by the Prime Minister, and implementation and monitoring committee chaired by the Vice Chair of National Planning Commission. And there are thematic committee under the member of the National Planning Commission, and provincial and local level we have SDG implementing and monitoring committee for all. And the share of financing, I just want to mention here is public sector financing, government financing is in total finance 54.7%, private sector financing 36.6%, cooperatives and NGO come under 4.3%, and household financing is 4.4%. So this is the financing structure of our SDG, and average annual gap is 585 million Nepalese rupees. So we have a strong gap. It is percentage on 12.8% financing gap every year. So we need to fulfill this financing gap. We need to work hard on various sectors, including progressive tax and salary structure, reducing recurrent expenditures, and all focused activities. Regarding the COVID response, it has adverse effect in all planning and development activities, but a most affected strata in society was well addressed, including vaccine and care and hospital care, and other services also. Education and construction and trade sector are also affected. So we have some.
So what were the major challenges during COVID that you encountered? Was it the capacity of the hospitals, or lack of vaccines? What was it that was like the main hurdle?
So basic care services, hospital services in the remote was the challenge, but in vaccine we did pretty well. Initially we have a first dose of vaccination was covered immediately within a month to nationwide. We have a good vaccination chain. In the health first, we have cold chain to each and every health center, but the medical care services was very poor, and especially the focus on the city, there is no problem, but in the villages we face that problem. Okay.
100% coverage, or
100% is not covered because people have another choices now. They do not want to involve in the vaccination process, but so above 80% in last year. For the first dose of vaccination, and
that's
70.
excellent.
Yes.
Did you have any threat from India? India had a lot of cases. Like there people coming in who were COVID positive from India in large numbers.
So we have very historical border system. We are entertaining from time immemorial that Nepalese people can go work in India and Indian people can work in Nepal. So this come and go creates some problem during the pandemic. So later on we manage in the border, both sides. So they have proper record systems, and in the both sides of the border, we prepare the camp for vaccinations and medical checkup and all the things.
Like for our own country, Pakistan, we were looking at our border with Iran and also Afghanistan. So there were some cases initially, when it started in Wuhan, they were like we were looking at countries where it started off first. And like there was such a fear that, oh, we are getting it from this country and that country, but then it equalized because it was all over the world.
Yes.
So, but my question was because there were so many cases in India at one point.
Yeah.
But so you were able to control,
Yes.
and thank you for that. Yes, thank you so much.
Thank you. And just in this COVID response, we have this health first, protecting people is second, according to WHO principle, economic response and recovery, macroeconomic response and multilateral collaboration, and social cohesion and community. So in this basis, we cope the COVID-19. And for the partnership for SDG, it's public, private, cooperative, development partners, and civil society. So we have this mechanism to work. For the VNR process, we will start preliminary consultations. Already we initiated this with all sectors of society, including private sector, business community, and civil society. We prepare the draft report soon, and we communicate to further better consultation and sharing the draft. And we finalize this and we submit to the HLPF. The major challenge, I like to conclude my presentation here because more presenters are there and still we need more time for discussion. SDG localization is one of the challenges because recently the local government election was completed and new local government are there. So we need to reorient them because there are new representatives again elected. And same thing, federal parliament and provincial parliament, the election was just concluded. So we need to reorient the elected representative for this. And on creating ownership in all tier of government is another challenge. There is a weak database we are facing, but we are trying to improve in this. So how we fulfill this financing gap is a major challenge, and our focus is SDG implementation. LDC graduation is also in process. Climate change is there, as Pakistan already mentions, from Islamabad to COP. So these things also we are facing. And last, resource mobilization is critical for the country like Nepal, which is still facing the underdeveloped situation. And
we've run out of time. So if you can do your last sentence.
So so we are in the process of preparing these things, and I personally, I and my colleagues presented here are personally involved in VNR process. So we will prepare a very good VNR report and submit to HLPF. Thank you.
What's your parent institution, ministry?
National Planning Commission. This is the ministerial organization. So thank you.
Thank you, Mr. Bhandari. Next, we have Mr. Veysel. He is representative of the Turkish government. So over to you.
Thank you. Excellencies, ladies and gentlemen. First of all, I would like to thank government of Pakistan, people of Pakistan, UNESCO, SNAS, SDPI for inviting Turkey to this distinguished international forum. It's a great honor for me to present Turkish experience during COVID-19 process about SDGs. First, I would like to summarize the overall approach of Turkey about SDGs. Turkey represented 2 VNRs in 2016 and 2019. And we are planning to present our 3rd VNR about 2 years later, after deployment of our new National Development Plan. Besides that, we have already integrated all of the SDGs to national development plans, medium-term programs, national investment program, annual investment program, annual program, and sectoral strategies and action plans. Besides that, national indicators have been identified to monitor the implementation of SDGs. About 131 SDG indicators have annually been published by National Statistical Institute of Turkey. First of all, I would like to mention about the most important SDGs by the view of Turkey. Those are SDG 1 and SDG 10. Those SDGs indicates ending poverty and reducing inequality across the country. As you know, the Gini coefficient of disposable income is widely used indicator to measure income distribution. While the Gini coefficient stayed almost constant during the COVID-19 period in Turkey. And nowadays, according to the latest data, it decreased to pre-pandemic levels, and we diminished the inequality across the population. To do so, we have implemented support system for children and special needs people. Besides that, we have also implemented tax rate discounts. We implemented treasury-backed credit guarantee system, public bank supports, mass housing payments, and allocated treasury real estate to all of our citizens by the view of not remaining any people. Hence, at the end of this period, our unemployment rate has decreased to 9.9% from 11% compared to pre-pandemic levels. Turkey has also made significant progress on the SDG 9. The non-negligible disparities between Turkish regions could have been burdened the post-pandemic recovery. Hence, regional and local measures and efforts are put into practice. Against this backdrop, place-sensitive approaches are applied to represent a valuable and potentially more effective alternative to overall blanket policies that tend to disregard the local context in which interventions take place. Besides that,
so I'd like to interject here. What were the local challenges that you faced, and you were kind of frustrated that globally no one understood?
Yeah.
So specifically, if you can share those, because it's important if we are faced with a similar situation again, so we can advocate more for local knowledge, like in Iran, and local needs. So can you please?
Yeah. First of all, we have increased organizational capacity of local managers, local management system, and then we supported especially small and medium-sized enterprises. Those are two factors to integrate local policies to high-level policies. So, as I said, small and medium-sized enterprise-oriented industrial policies are developed, including grants and loans. Strategies that focus on promoting related variety across Turkish regions helped many areas of the country by gradually and cumulatively to upgrade innovative and productive capabilities of domestic firms and companies. Also, the ability to adapt development strategies to the local context required while working with local governments intensively in order to develop locally tailored solutions that efficiently and effectively respond to nationwide priorities. COVID-19 pandemic has affected the capacity of the health system and has led to the disruption of primary health services. Countries need to strengthen and further expand capacities for population-based surveillance. People with income below a certain level should be provided with free health care services. They should benefit from the health system equally like all other population groups as in Turkey. In the field of health, provision, coordination, and monitoring of research and development activities should be strengthened by establishing the developing production capacity for technology-based products such as vaccines, drugs, medical equipment, and devices. The Turcovac vaccine was developed by Turkish scientists. It is an inactivated COVID-19 vaccine, and it's also sent to many countries to strengthen global partnership, including Democratic Republic of Congo, Benin, Niger, Tanzania, Somalia, Mali, and Sierra Leone.
So if we move toward conclusion, I mean, you know, we respect and we really admire what Turkey was able to do, but can you just give us the salient points and
of course,
we can, yes.
Of course, thank you. I would like to mention about health services. For example, total number of hospital beds per 110,000 people was increased from 280 to 310 during the COVID-19 period. If we talk about supports, short-time working allowance, cash wage supports, unemployment allowance, compensatory working, returning to work supports are provided to citizens. Lastly, I would like to mention about SDG 11 climate change and SDG 13 sustainable cities. Turkey has announced 2053 net zero target and ratified Paris Agreement. In that manner, Turkey has been striving to transform its economic sectors and production dynamics. For example, Turkey has just opened a green production plant site as a gigafactory of the electric car. And this automotive company founded as a joint venture years ago during the pandemic. And Turkey has started to produce born electric platform car and deploying electric charging units across the country. And this was the first domestically built electric car will change the mobility behavior of Turkish citizens, and this car will facilitate electromobility and green mobility transformation of Turkey. Thank you so much.
Thank you so much. Really admire the way you handled COVID. And I understand that Turkey was also locked down. You know, it had a lockdown.
Yeah. Especially during Ramadan. Ramadan months. Okay. Close all of the country.
Thank you. We have one more speaker.
Yes, we have one more speaker. Mr. Razik Shinwari, he's representative of the Afghan government. So
Thank you, ma'am. Excellencies, ladies and gentlemen, assalamu alaikum and a very good morning. Always had a devastation effects on socioeconomic and or foreign. Our former health minister once said in an op-ed in one of the health related website, he wrote that when COVID emerged, he tried his best to convince his peer colleagues that COVID is not an hoax and it's a reality. And that was the starting point of Pakistan welcoming the COVID as a global pandemic. Starting as a health emergency, COVID evolved into an economic and human crisis of huge proportion. The economies plunged, workers left without jobs, and income fell. Trade and supply chain disrupted, a cross-border of flow of goods stopped. There was a kind of ban on human mobility, and supply shock led to fall in income and aggregate demand at country level as well as at regional and sub-regional level. Extreme poor and those just over and above the poverty line remain vulnerable, particularly women and marginalized segments of the population. Multilateral institutions warned about the imminent worst ever recession and urged countries to take necessary policy actions to slow down the impact of the COVID. However, innovation and IT-led technology development, of course, the improvement in the biotechnology led to the containing the human loss through drive for vaccination, and advancement led in the flow of work continues. Emergence of the new normal took place. However, life continued, but no more remained the same. So at that point in time, the UNESCAP estimated that due to the COVID, 132 million people are pushed into the poverty based on the $1.9 per day. So that was the stark reality when we were facing the COVID-19. Pakistan, not immune to COVID impact, of course. COVID exposed 44% of Pakistan population to the pandemic. With 24.3% poor people, the poverty-ridden people in Pakistan, and 20% additional just around the poverty line were exposed to the pandemic when it emerged. So the informal sector employment share in Pakistan is 72.5% and was therefore at a high risk of losing their livelihood. With labor force at 71.8 million in Pakistan, Pakistan Bureau of Statistics revealed that 38% of total workforce in Pakistan, which equals around 27.3 million, were affected by the COVID, and 74%, which equals around 15 million of informal sector work were affected. It's important to note that 72.5% of employment in Pakistan is being provided by the informal sector, and that informal sector was mainly exposed to the impact of the COVID. The industrial sector with 25.4% share in employment and services sector with 37.2% share were also severely hit by the COVID in Pakistan. And in the range of 15 to 26%, there was a decline in employment in manufacturing, construction, transport, communication because of the COVID in Pakistan. SMEs, which composed of around 5 million, there are 5 million SMEs in Pakistan as per the data of the SMEDA, the Small and Medium Development Authority, and 90% of all enterprises basically in Pakistan are basically SMEs or the small and medium enterprises, and also contributes to 40% of GDP. It's a huge number, and 25% of overall exports in Pakistan are being basically contributed by the SME sector, was severely hit by the COVID. It's important to note that 78% of the non-agriculture sector employment in Pakistan is being provided by the SME. So with these...
Sir, I would like to interject here, and I would suggest that we bring out, since we're talking about COVID in detail and how Pakistan dealt with it and the challenges, also to bring out the successes. I think Pakistan managed COVID very well with our coordination unit and vaccination and also, monitoring the numbers of patients. So I think Pakistan was way ahead of any of its neighboring countries. So I think it would be great if we could highlight that too. Thank you. Thank you so much.
So because of that negative impact of the COVID, Pakistan economy plunged into negative growth trajectory, and the growth was like minus 0.98% in fiscal year 2020. So how we are Pakistan's story of COVID is that of the resilience, and that's the crux of the Pakistan VNR 2022 story shared with the world community. The COVID pandemic in Pakistan, however, exposed our health sector deficiencies and lack of preparedness of such an emergency. There had been increased risk of food insecurity, hunger and malnutrition, uptick in violence against women. The shutting down of the universities and schools impacted around 42 million school-going children and adults. And 70% of the enrolled children in rural areas and urban slums were potentially at risk of being taken out of school. And 22.8 million children between 5 to 16 years of age not attending school, representing around about 44% of total population in this age group.
Sir, we have 3 minutes for you.
So government of Pakistan basically provided different policy relief, like the COVID relief fund of around $8 billion, large social protection ever been provided in the region, rupees 203 billion one-time emergency case support at the rate of 12,000 to 16.9 million families. So it comes around 100 million people, almost half of the population were being provided. Monetary policy was eased and State Bank policy rate was slashed down by around cumulatively 625 basis points. So there was a small lockdown, wage support was provided, industry and SME support was provided, and economy rebounded with a V-shaped recovery. It is important to note that the total support provided by the State Bank during the COVID was around 5% of the Pakistan GDP. So even it was larger than the support provided during the financial crisis back in 2008 and 9. So I think just the last few points, the selling safely necessitated utilizing all policy options prudently and intelligently while considering trade-offs, synergies, and conflict in implementation of SDGs. As it was mentioned yesterday by Dr. Suhaili of the SDPI, that the present era is of 3 C's. It's the COVID, it's the conflict, and of course, it's the climate. But solution is not a straight line equation. One size fits all approach is not going to work anymore. Local problems requires local solutions. The whole government and the whole of society approaches is also important, but the gap between knowing and doing need to be filled. And there where the regional cooperation among the member countries is very important. That's all, thank you.
Yes, local solutions are what is necessary. This is a very positive note to end our presentations at.
Yeah, yes, that's all for our country representatives. Ma'am, next, as chair, I'd like to request you for your remarks now.
Yes, and do we have some time for question answers?
Yes, after this we'll have time for
okay.
answers.
So I'll be very brief. And so it's been a wonderful session, and it's made me travel to each of the country. And in my mind, I was going through all the news that we had the smartphones and we had TV on what's going on in Iran and what's going on in Nepal and what's going on in Turkey, Maldives. So we were all very concerned with each other, and while huddled in our respective homes and lockdowns and fear of this unknown traveler from one border to the other, no way of stopping it, and destroying economies, livelihoods, instigating violence, very negative on children, very negative on our health systems, our budgets, our countries. So it seems it's behind us, but this session is very important to review, because we have to learn through history. And it was the first very big pandemic that hit the world, and the big countries, China, the USA, and the big countries. So today is, for me, the big takeaways from today's presentations by the country reps is that though the Sustainable Development Goals connect us globally, regionally, but actually it's the context of the country. We do agree on all of these because these are under the binding of our constitutions and governments and states. We are supposed to provide the provisions mentioned in the SDGs to our respective populations. And VNR is a very good effort, is a very good reporting mechanism for saying that, okay, we come together globally, but the context of our own countries is extremely important, as Iran has indicated, and as Pakistan has also, and most countries have indicated that we cannot have one size doesn't fit all. It can't be a cookie cutter approach. But we have to be, it's a good measure of all those 16, 17 goals of seeing where our country is going, and for ourselves, and not only sharing it with the global, entities, but also sharing it with our own people to understand more so. So, and Maldives mentioned, the link to IT database, having, a lot of us countries have offices, to support this, and it's placed in various ministries. But population and, distribution by population is extremely important, because each of our countries sitting here has a different size, and distribution of resources and what our budgets look like. Talking of COVID, although it's very good to take a historical perspective, but we've just been through a very huge flood, and there's still a lot of question marks, because it's a global crisis which has hit Pakistan, but globally nobody's ready to take responsibility of that. So the entire brunt comes down to Pakistan. So we have to, it's just happening very fast, one thing after the other. And how do we grapple with that? Local context and local bodies, systems and local elections. Nepal very rightly talked about the parliament and their parliamentary system, and taking the elected representative on board. Being an elected representative myself, I'm very happy to report that I think 7 or 8 years ago, we were able to have a SDG secretariat within our own parliament. And in that, I'm very happy to share with you that I created a subcommittee on child rights, because 7 of the goals have children's, are relating to children. And out of that, we have recently, announced the Parliamentary Caucus on Child Rights, looking after children. I think one of Turkey mentioned children and people with disabilities. Only countries who have progressed a lot in their basic provision of basic necessities will, in my experience, talk about children and differently abled population. So we have very different realities here. And I think that the way to move forward is to regionally integrate with each other on what are the positive and what are the challenges, and keep on reminding the world and ourselves that our local context and our local bodies, because I'm a constituency politician, मैं elect होके आई हूँ parliament में, तो whenever I'm talking about a said issue or a set problem, I'm always thinking about the constituency, the people in the constituency. So we have to be, our hearts have to be with the people, and to be able to, I think one of the presenters talked about 1 and 9, you know, the poverty and inequality, 1 and 8 or 1 of 9, you know, that matters. And yes, that's all that matters in today's world. I mean, the others are, you know, added. So let's join hands together, and we are very diverse, but in our issues, in our dilemmas, and in providing strength and support to each other, we are together. Thank you so much.
Thank you very much, madam. With this, I will move on to question and answers. We have time for 2 questions. So, gentlemen over there, if you can hand him the mic, please.
Thank you. My name is Salman Khan and I'm from media. My question is from the representative of Turkey. Sir, Turkey made a significant progress regarding SDGs and ranked 17 and SDGs index, but the recent economic situation and especially the inflation rate, which has been surged up to 85%, suffered people a lot. So can you please tell us that what was the causes of this high inflation rate? Because some people are of the view that I think that the interest rate kept very low by the central bank of Turkey, and also the import was very high. So what's your take on it?
Thanks for your question. Turkey is in economical transition progress. We are trying to transform our economical sectors to produce more and import less. To do so, such macroeconomic policies are applied. And as I mentioned in my speech, we are trying to accelerate high-tech products, production of high-tech products. To do so, related macroeconomic policies are applied in Turkey. Thanks.
All right. Thank you, sir. Another question, if anybody has one.
Assalamu alaikum to everyone sitting here. My question is from every one of my respected panelists. Question is this: we are the sufferers of the climate change. Our sustainable development is based on the actions of other countries. We are not the doers, we are the sufferers. So, ma'am, any policy, if you highlight that that as every country that has caused this disaster, these disasters for us, they have, do we have them on our table? They are ready to contribute in the achievement of sustainable development goals of the countries that are not the contributors of these causes. Thank you so much.
Yes, whoever would like to answer. If
Climate change is indeed it's a problem impacting a lot of countries in the region, no doubt about that. Pakistan has been playing a very pivotal role. If you have read about the recently COP27, parliamentarians and of course the government of Pakistan, represented by the Prime Minister of Pakistan, Mr. Shahbaz Sharif, has basically played a very pivotal role in making sure to have damage and loss funds the regional and the global level, which was basically be contributed by those countries who are and have been contributing to the climate emissions and have to be distributed among those countries which are very, you can call it, heavily affected by the climate-induced calamities. The recent floods is one example. PDNA has basically is estimated around $30 billion damage and loss estimated funds for Pakistan will be required in the next couple of years. And Pakistan, as the minister told yesterday to the audience, is going to have a donor conference probably next month to deal with that.
I would also like to comment. my colleague from the ministry has indicated about the flood situation. Yes, we are not even responsible for 1% of the emissions, and we were like the worst hit. We are one of the first countries. It will come to other countries as well. But to say that each and every disaster that happens that is a hurdle in for us to achieving the SDGs is not the right thing. You know what we haven't done in Pakistan as a politician, as a constituency politician, I say, which is our failure, is that we don't have a local body system. People have to take ownership. And the size of the country that Pakistan is, we cannot have administratively centralized systems. So that is one. And our fiscal space, jo aajkal hamari maashi surat hai, and our fiscal space is also our own doing. And we have to, each one of us, ये किसी एक के कंट्रोल में नहीं हो सकती, ये हम सबको सोचना होगा कि हमने किस तरीके से आगे बढ़ना है. और ये आप लोग जो हैं, आप यंगस्टर्स जो हैं, आप लोग ओन करें ना कि कितना बुरा जो भी हुआ और उसके अलावा के सॉल्यूशंस क्या हैं. We have to start thinking about solutions to it. Some of it will be of global doings, but most of it is our own doings. And we need to see how we can rectify, because every problem has a solution. And you are the ones who will provide the solutions to Pakistan. Thank you so much.
Right. If there aren't any further comments from the panelists, I'd like to conclude the session. Okay. So with this, I'd like to bring this session to an end. Thank you everyone for your patience and for listening to us. And thank you to all panelists for taking our time. Tea is served outside. Just let me please remind you that we have another session after this at 5:30. It's about sub-regional perspectives and review of cluster of goals for HLPF 2023 in South and Southwest Asia. I hope to see you all there. As for the panelists, I'd request you for 2 more minutes of your time for a photo. Thank you very much.